Hi, today we're going to talk about posture and the things related around posture. For example, different posture types, what can cause the different posture types, and what we can do about that once we've got a certain type of posture in order to try and cure any pain that we're suffering from. So to start with, we've got to look at why we would look at your posture and why it's worth analysing that. Well, the reason is because it obviously gives us some very big clues as to what is causing any pain. Because through analysing your posture, you can see what areas of the back are being particularly stressed more than others. If we look at an ideal posture type, is where our body is perfectly balanced, as we can draw a line from our ear, through our shoulder, through our hips, our knee and our ankle. If everything is in line, that's the major joints of the body, then the body is balanced on itself. So it's not being leaning forward, it's not leaning back, it's perfectly balanced. And therefore the muscles that are supporting the body, both on the front side and the back side, have to work only minimally to hold that upright position. Now this applies in all different types of positions, so whether we're sat down, whether we're stood up, whether it's for our working day, then it's still relevant, our posture types. It's not just when we're stood still. You know, if we're running, if we're walking, it's all very relevant. So if we do too much of any one particular posture type and that posture is not in a desirable way, so therefore the muscles either on the front of our body or the back of our body are being worked too much, then that can cause problems. So that's why we can look at our posture types, and it can give us good indications on what areas are being overworked, and therefore from the muscles or the joints being overworked, it gives us an idea on where the problems may lie. And also it therefore can give us a path out of pain. So a route or a program, a routine can be developed to try and relieve some of those stresses that you're causing in your daily activities. When we're younger, we all have a good posture. When we're children, you know, we start out with good posture, and it's for our daily activities that we develop these, if you like, bad posture types that can affect us and maybe cause us pain. So that's the things that we look at as to the cause of these bad posture types. So for example, if you're sat down for a lot of the day, that activity will cause stresses in your body in certain places, will therefore alter your posture and create an imbalance throughout your body. Instead of having the nice straight line up through the major joints in your body, that activity, so sitting down all day, will cause imbalances which cause a shift within that perfect posture and form an alternative posture which is less desirable to the body. Realistically, you know, over a short time span, that probably won't cause you too much trouble, but if it's carried on for many months, years, possibly, then you know it can lead to further problems. And everyone is different. You know, some people might have poor posture but suffer no pain. Other people may present with a reasonable good posture but still have pain. So you know, we have to look at this individually. When you look at your posture, just bear in mind that you know it may not be an exaggerated form of any one posture, but if for example you're presenting with just a small hint of one or the other, then look into how to correct that, because just a small angle, maybe at the pelvis, maybe in the lower back, can cause possibly enough pressure on certain tissues to cause you pain. And that may have changed just recently. You know, you think, well, I haven't really done much different and all of a sudden I've got back pain. Well, it could be that it's been building up for some time, and it's just recently that, you know, maybe the angle of the pelvis now sits just slightly more than it used to. and that is enough to start impinging on certain nerve tissue, or maybe overworking certain muscles to the degree that now they're presenting with some pain and stiffness. So keep your mind open to the fact that it may not be a completely exaggerated posture type, but presenting in small amounts of any one kind can give us a good indication on where we should start looking to undo this and start to make road back to a more desirable posture type. So we can see that it's everyday activity really that causes these posture problems, and that's where you should start to look at, what do you do every day, what sort of position you sat in, how do you stand, what muscles are you using, what positions are you in, and that's the thing that you need to analyse. And we have to be open to the fact that it's not easy to correct posture. If I said to you, well, stand up straight, then you probably do it for maybe a minute or two, and without even thinking about it, you just then resume your old position again. So it's not realistic to just say, oh, from now on I'm going to stand up straighter. It doesn't work like that. We just can't do it. As you say, sit up straighter instead of slouching over your computer, over your desk. It just doesn't happen. Once we've got into that position, if that's become, if you like, our blueprint position to work at our desk, hunched over, we can't undo that just in 2 minutes. It takes a process of repeating a good pattern over and over and over for it to become normal again. So basically we are resetting our blueprint. So when you go to sit down at your desk, instead of sitting down like this, you automatically sit down like this. It has become a reset. Your blueprint has become a reset again. So we have to create that. That doesn't just happen. And the way it gets created is by repeating it over and over and over. Now, again, that's very easy to say, but realistically, even if you tell someone, well, every 5 minutes make sure you're stood up straight, they can do that, and there's two things. One is realistically that won't happen every 5 minutes. You get distracted, you're doing something else, it's not realistic to keep standing up straight. And also, it's very difficult to get in that correct position every time. So the best way of looking at these problems is to start undoing any tension that is preventing you from getting into a good position in the first place. Because a lot of people, we say stand up in the position that we want them to, and they can't even get in that position to start with. So if they can't get into the position, there's no way they're even going to hold it. So you've got to be realistic, and so you have to undo the tension. You have to create more flexibility, more movement, better mobility to be able to get into the position in the first place. So the easier you find it to get into the position, the more likely you are to be able to A, go to that position in the first place, and B, hold that position. So you've got reducing tension in the muscles, and then we've got adding strength to the postural muscles that need it, that will have become weakened because you've adapted a less desirable posture. So the muscles now that hold you in your posture you currently have will be strong at holding that posture, but they won't be strong at holding the posture that is more desirable to you. So that's where possibly, how it has come about, because maybe there's some weaknesses in some of your postural muscles, which means that your position has altered slightly, so it stresses the stronger muscles a little bit more, which then obviously have probably been overworked and become tighter than what they should be. So we look at strengthening areas that need to be strengthened in order to hold the new or the better posture. So they're the two things that you should need to work on, and in doing that you can therefore try to establish a better position as you're working through certain movements, exercises, stretches, to hold a better position. So A is to be able to get in the position easier in the first place, and B is to be stronger to be able to hold those positions. When we look at what affects the posture in terms of within the body itself, there's one definite correlation that happens in most people, and that is that the muscles within the upper legs, the thighs and the hip area, play a very, very important role in what position the pelvis holds. So, you can imagine it like a guide rope on a tent. It's hanging from the top and anchored down into the ground, and that is causing an anchor on that tent to hold it in position. Well, that's very similar to the pelvis, the way the pelvis can rotate on the top of your hip joints, and the muscles that are running across the hip joints down into the upper legs. Now, those muscles, if they're particularly tight, instead of letting the pelvis rotate as it should do, well, they're fixing it in position. So if your pelvis should naturally return to a more, say, forward position, but the muscles in your hamstrings are tight, instead of letting it come forward, well, they're just going to fix it back. So what happens over time is gradually that position becomes your normal position. So your pelvis is going to be fixed. Instead of nicely just anchored a little bit forward, it's going to be pulled backwards slightly. So if your pelvis is pulled backwards slightly, that's going to alter how your spine is going to sit on top of it, and the angles that your spine is going to follow as it goes up towards your neck and head. So there's, as a starting place to work, then look at the muscles of the hips and the upper thighs, particularly the hip flexor muscles and particularly the hamstring muscles, as they're the major ones that are going to hold it either in an anterior or posterior rotated position. So there's some points to work with there when looking at your posture and how to correct it. From that point on, then you need to look at particular movements and stretches and exercises to try and mobilize those areas and try and undo the harm that is put in through your daily activities. Now, even if you've been doing, say, a desk job for many, many years, or any activity, driving, maybe you're on your feet a lot, maybe you're a nurse or a construction worker or something like that, and you feel like, well, I've been doing this for so many years, I can't possibly undo it. Well, you can. It really can happen, and it doesn't take as much work and effort as you think it might. It's a question of getting into daily routines and habits that start to undo the damage, if you like, that's been created. And it's very, very achievable, but it just needs a little bit of routine and a little bit of structure to start to. You need to understand your body a little bit and to understand where the tension has been put in and what movements and what exercises can possibly help to undo that. So I hope that's been of value to you, and I hope you can see that it's very worthwhile to analyse your posture and the key things that affect your posture, and how we can work to undo any changes that may be less than desirable that have been created through your daily routines.